to the Rare Diseases South Africa webinar on sickle cell. If you're wondering why Kelly's not speaking and I am, huge apologies from Kelly. Unfortunately, she had a personal emergency quite late this afternoon, and she's had to drop out. And so I've stepped up in her place this evening just to chair and introduce the speakers and handle the Q&As. But welcome everybody. It's great to see so many familiar names that are participating. I see Merlin there, I see Bianca, I see Nabila, and so many other familiar names. So it's great to see you online. I hope everyone's surviving the extended lockdown. And so, yeah, so we're very excited to be here for our sickle cell webinar this evening. And we're going to have a series of 3 panelist speakers. So the format that we normally take, and we're really excited and privileged that this has been funded today by Novartis. And our 3 speakers that we're having tonight, who are going to speak for about 15 minutes each, and then we'll have a Q&A session directly after, and then at the end. So without much further ado, I'm going to introduce our first speaker, Prof. Ambroise Wonkum from University of Cape Town. He's a professor of medical genetics. He's also the director of GeneMap and the deputy dean of research there. And he's got a very international and interesting academic and geographic life experience, having done his MD training in Cameroon, and then his thesis in cell biology and medical genetics training in Geneva, Switzerland, and then ending up doing his PhD in human genetics at UCT. And he's written a lot of peer-reviewed papers, and his research focus is obviously on sickle cell disease and genetics of hearing loss in Africa. And he's already been, and we're privileged to have him today because he's already been involved pretty much the whole day in another sickle cell event. So, and he's very involved in sickle cell work on the continent with a quite significant big Sickle Cell Africa Data Coordinating Center grant underway, developing various work in Tanzania, Nigeria, and Ghana. And Prof is going to talk to us about perspectives in sickle cell disease, the genetics, and the public health intervention. So go for it. Thanks, Prof.
On mute, share camera, and the last thing is to screen.
Perfect.
Share, it should work now. Okay, I'm really privileged and pleased to share, to be invited to speak for sickle cell disease support group and rare disease sort of particular. I can see that this initiative funded initially by the graduates have survived to the.
Sorry, I think we need to speak. We need to switch off your video.
Will be now on. Okay, on sickle cell. It means that there is an increased awareness in this country where sickle cell is not normally. So today I will try to show how genetic research and genetic technology can accelerate both prevention and treatment for sickle cell disease. Actually, in the previous session, we had a 3-hour session on gene sickle cell disease. Sickle cell disease mutation in the world ago, so time of Pharaoh in Egypt, but the first was known in about 110 years ago in American student. It was for the very first time by a German pediatrician. We have proposed since 2 years through the sickle cell disease ontology that we can equally call it banana cell anemia. It will work for populations that live under the tropic much better. The Sickle Cell Ontology project is one of the projects that we developed with my colleague Nikki Mulder. It's a collaborative effort that included scientists all over the world to define a control vocabulary for sickle cell disease that will allow an acceleration of research and sharing across the world. It's probably one of the proudest projects of our collaborating center, and I'm happy that Claire is part of this meeting because she has been helping us on some of the aspects of the sickle cell disease ontology. Because having a threat for sickle cell disease is associated with protection to malaria, the prevalence of sickle cell disease have been very, very big in area of the world where malaria is prevalent, with the focus on sub-Saharan Africa, where 80% of the 300,000 new births per year are born. And sickle cell actually originated in Africa about 7 to 5,000 years ago and moved across the world. I've been very, very blessed and privileged to be trained by a real strong mentor that have made their mark on sickle cell disease and hemoglobinopathy. I'm still working toward a legacy, so I don't know if I deserve my space fully on this professional pedigree. The complication of sickle cell disease associated to the distortion of the red blood cell that take a banana shape, gets sticky, unpleasant flow of the blood in little tissue, which make
Sorry, we've lost you, Prof.
the mortality.
Hello? Prof, you still there? I think we might have lost you completely.
Helen, sorry, I think his internet's just a bit sticky.
Unstable.
I see he has reappeared again.
Okay.
Prof, can you hear us?
Can you hear me now?
Yes.
Yes.
Okay, I have to start again because so share my screen again. Share. Okay, I was saying that despite that the condition exists for most as recognized by the medical profession, the mortality in adults have not changed even in high-income country, where most adults will pass away in the 5th decade, while the life expectancy is in the 8th decade. In Africa, without treatment, it's estimated that 50% of children will not see their 5th birthday. So there is a need in all parts of the world to look for new solution for prevention and treatment of sickle cell disease. The complication that are associated to mortality are cardiovascular complication, and these complications are associated to a genetic variation. I would like to present a three-way where genetic can help prevention and treatment of sickle cell disease. The first is a detection of the condition before birth. We introduced this in Cameroon and in Cape Town, but this also may lead to some ethical question in the sense that reproductive option open the door for termination of pregnancy. And we found through multiple social science studies that this was not necessarily acceptable in many African communities. And there was also a conflictive value base between health professionals, parents, and also patients themselves. So we think that this is probably not the way to go on the continent, but rather to focus on a genetic variation that affect the phenotype and complication of sickle cell disease. The general model of disease in whatever the condition is of the environment, but most phenotypical clinical expression are due to gene mutation. For complex disease like high blood pressure, diabetes, asthma, there is a environment. We would like to think that sickle cell is the best of both worlds in the sense that this is a very common condition in Africa, but that is subjected to genetic variation, which offer opportunity to look. We have shown that if you have sickle cell disease and alpha thalassemia in the same person, this increases chances to be diagnosed much later. Actually, this is associated to a beta phenotype. We reported this about 6 years ago, and this year it was confirmed in Kenya that even in a newborn cohort, having alpha thalassemia and sickle cell disease increase survival. This means that for children that are born with sickle cell disease, a simple genotyping of alpha thalassemia will predict a severity. Another condition that was investigated in my group was the association of genetic variation and pain in sickle cell disease that can also predict classification and hospitalization rate in sickle cell disease. And lastly, having kidney dysfunction and kidney disease in sickle cell is also associated to specific genomic variation, and specifically APOL1 risk allele are associated with prediction to develop microalbuminuria. Once again, that means that it's a variant that can be used for predictive model in the patient. Stroke, one of the devastating complications in sickle cell disease, is also associated with multiple genetic variation. And it's our hope that using this variant, it will be possible in the near future in a newborn with sickle cell disease in a combination and a mathematical model to predict which patient might be more sick than the other and determine more specific therapeutic attitude. And lastly, genetic can help for treatment for sickle cell disease. We know that if you have sickle cell disease and high fetal hemoglobin, your survival will be much greater. Having high level of fetal hemoglobin, which is an hemoglobin that exists only when we are the mom, the tummy of our mom, is also subjected to genetic variation. And in particular, one gene called BCL11 is responsible for increased level of fetal hemoglobin. And when this condition was, this fact was discovered a couple of years ago, a deletion, removing BCL11 in sickle cell disease in cure sickle cell disease, which means that if we remove that genes in patients with sickle cell disease, potentially we can definitively cure sickle cell disease. But the problem with BCL11 is that we have a nature experiment, so experiment from nature that shows that there are real patients in life that have a deletion in that genes. They have an increased but they also have some problem, disability and some malformation, which make this gene technically undruggable. But it doesn't finish there. And a colleague of mine, Stuart Hawkins in Boston, found that there is some variation that changes the level of these genes, but only in red blood cell. In other words, if you remove that genes, that you would change that variation specifically, that is erythroid specific, you will increase the level of fetal hemoglobin only in red blood cell without having the deleterious event on brain function. In summary, this gene called BCL11A, if you remove it, you increase the level of fetal hemoglobin, but it may lead to neurodevelopmental abnormality. If you remove it only in one specific part of this variation, which is specific to erythroid, which are the baby red blood cell, you increase the level of fetal hemoglobin only in red blood cell and you cure your patient. And this is one of the bases of a new gene editing approach that have now been developed in clinical trial. And in 2017, that was a typical example of the first case reported with sickle cell disease cure with gene therapy. There have been numerous other cases that have been reported all over the world. And it's our hope that we need to develop this technology on the continent to address the matter of the 300,000 new babies that are born every year and an estimate of 15 million sickle cell disease patients at a given time on the continent. There are many other research that still need to be investigated to improve our capacity to use genetic for treatment of sickle cell disease. Some of this research will need to understand what are the variations that are more prevalent in population of African ancestry. Some of these research will allow us to understand why is that some patients respond very well to hydroxyurea, why others will not respond well to hydroxyurea. This is one of the research in one of the PhD students in my group. And we also have used erythropoid stem cell from umbilical cord to explore the relation with treatment of sickle cell disease and hydroxyurea, and provide a model that can also help develop alternative treatment that increase the level of fetal hemoglobin without altering gene function in sickle cell disease. These are the hands of my former PhD student that performed this specific research. And recently, also work in collaboration with Grutus Care Hospital and patient in Grutus Care to try to look of the profile on gene expression in patients that receive hydroxyurea and those that doesn't receive hydroxyurea. And we came out with a model of specific genes that are changed, microRNA, and also that influence the increased level of fetal hemoglobin. And we believe that these microRNA in future, if we can put them in specific device, we may also provide a new option for treatment that will not jeopardize the patient and reduce side effect. So in summary, we strongly believe that genetic sickle cell disease in three ways. The first is primary prevention that provides reproductive option. The second is to use genetic for anticipatory guidance. And the third is to use genetic for gene editing and gene therapy. And I thank you for your kind attention.
Okay, thanks very much, Prof. If you wouldn't mind unsharing your screen again. Has anybody got questions? If they have, can they just pop them in the Q&A or in the chat, preferably the Q&A, so we can just bring them up so Prof can answer them directly. I think while we're waiting for those questions to come, I think what fascinates me so much about sickle cell disease is, and what is so encouraging, is the degree of research that's ongoing. And in so many cases, there is much less of a focus on diseases that are so prevalent, at such a high birth prevalence. in Africa clearly see the difference with sickle cell, and just because of the high prevalence in Africa, and it's really getting some of the attention and the funding and the high level and excellent research that it requires, and just outlining the amazing stuff that is happening with regards to sickle cell. And especially just knowing that it's really on the cutting edge with gene editing and so on, and just really looking at the African variants, where we hear this with so many diseases, rare diseases, and the more common congenital disorders, that the genetic variants, the African genetic variants, just aren't getting the focus and the attention that we so desperately need. So thank you for that. Questions, let's have a look. We have a, thank you for a wonderful presentation from Merlin. And no other questions. I did such a great presentation, there's no questions at the moment. So what we'll do now, I think, then we'll give time for those other questions to come. And if you'd like to stay on, Prof, to hear the other speakers, we can give an opportunity throughout for people to come and bring their presentations. But thank you. I'm really excited to hear so much is going on. Oh, there's a question from Claire. You spoke about using messenger RNA as therapy. Could you elaborate, please? Or was it mitochondrial RNA? I can't, oh, micro RNA. Okay. Yep. Just need to unmute you, Prof. Is Prof still on? Oh, we've lost Prof again. Okay, so what we'll do is we'll go ahead with the next speaker, and we'll come back to that question at the end, Claire. He was having rather an unstable internet connection, so maybe that will improve when he comes back to us. So, okay, so I'm very excited to introduce our next speaker, who I met last year, it's almost a year ago now, in Cape Town, Caregivers Bakatukanda. He's the founder and president of Sickle Cell South Africa, and he's an advocate for sickle cell, and he's also a rare disease warrior himself, being diagnosed when he was 6 years old with sickle cell disease at the Red Cross Hospital in Cape Town. And he's going to be telling us the patient perspective, about talking about what it's like to be living with sickle cell. Thanks very much. Caregivers, please go ahead. There we go.
Hello. Can everyone hear me? Hello.
We can hear you. You can go ahead.
Okay. Thank you very much for the introduction and for the opportunity given again once to me. Living with sickle cell is something that most people don't understand, especially in our communities. Well, we find that you go to the hospital and the doctors tell you that this is what is happening to you, your red blood cells are like this, but they don't know how can I say this, how we experience it or how we feel having sickle cell. Most people, when, like in our communities, when you tell someone you have sickle cell, they tend to how can I say, I can say discriminate or look down on you because it's a blood-related disease, but they don't really understand that it's more than just that. Well, for me, since I was diagnosed with sickle cell, a lot about me has changed. Well, only recently, but I used to constantly be in hospital. I can actually say the hospital was like my second home. But there came a time when I started believing in myself. Now, what do I mean by that is that I started understanding the disease. Instead of rejecting it, I got to accept it. And I decided to learn what it is and how I can better myself, still live a normal life while while minimizing the effect of sickle cell. Not like many people do know that I do workouts, I do exercise, but people always wonder, how is that possible when I have sickle cell? Well, for me, it's very simple. If you look at a regular human being going to the gym, working out, doing sports, it's tough. But if you get to understand, it's what they're putting their bodies in a challenging way. So they kind of like in a challenging way. So their bodies are adapting to the new changes that they're bringing up. It's the same with me. When I go maybe to the gym and I'm working out, I'm forcing my body to adapt to the new changes. The only difference is that with me, it's twice as hard compared to a normal human being. Well, with that being said, when I was first diagnosed with sickle cell, when I was growing up, I used to be malnourished. And I realized that thinking of having sickle cell and constantly being in hospitalized affected me mentally, physically, and sometimes also was the cause of me sickling. I'm not sure if anyone gets like is getting me on this point, but as time went by, you know, when I was still young, actually, sorry, when I was still young, I used to not take my medication at all. I used to skip days without taking my medication, but now I've gotten used to taking my medication that it's now a good, I can say, beneficial thing for me to do. And recently, I've not really been hospitalized. I've been like, I think a year now that I've not sickled. I've been rather living life to the fullest. So what I can actually say to other patients out there or people that feel like they need to give up or that it's the end of the world, it's not. It is not the end. Because I get to meet a lot of parents who have kids that have sickle cell, and they they want to withdraw the kids out from school. They want to stop the kids from playing with their friends, stop the kids from living a normal life. And that is not wrong because they worry too much about what's going to happen to the child if the child maybe falls sick or when the body is under stress, but they don't see it in a beneficial type of way. So rather, instead of you to focus on the negative part of sickle cell, rather see it as a good thing. See it as an advantage point for you to do greater things. You know, that's what I do. Like it has actually encouraged me to actually speak more about sickle cell, and like today I'm advocating here and there, educating people on sickle cell because I've gotten to accept it. But many people fail to do that. And as a patient, is the worst thing that can ever happen to you is to have sickle cell. I will not lie. Those sleepless nights, back pains, chest pains, it's the worst. It is completely the worst. But there has been also a couple of times when when I went to the hospital because I was having a few crises, and the nurses will not know what I'm talking about. They wouldn't know that I need to be placed on oxygen. They wouldn't know that I need to uh, be placed on a drip. And I will have to educate them, or not educate them, but inform them that this is what I need for me to get better. Like I've gotten to understand sickle cell to a point where like, I can tell whether I'm about to sickle and when I'm not. Like I remember the last time I was at World Sickle Hospital, uh, last year, if I'm not mistaken. I I went to the nurses and I was like, I need to be placed on a drip. I need to be placed on oxygen because I can feel myself sickling. And the nurses were just laughing. They're like, how can you be sickling while as you cracking jokes and talking to us? And I was like, no, I know my body and I know what I'm talking about. And they gave me my treatment and I felt much better. So with me, it's all about understanding the disease. That's all that matters. As long as you understand the disease, you can do anything. you can live a normal life. Like I encourage other patients, other people with sickle cell, that instead of hiding yourself and trying to find for a solution or a cure, rather accept it, because it's part of you. It's who you are. You know, see it as an achievement. If I don't know if that's the right word to use, but see it as if it's something God sent, and a lot will change. A lot of things, and your perspective on sickle cell will change. That's pretty much it. What I need to say on the patient side. Helen.
Hi, thanks. Sorry, I was having problems unmuting.
Okay.
Thanks, Graduates. We're getting a lot of comments coming through on the Q&A saying it was so relatable, and yeah, I think it's great. And I think we've got a number of other patients online as well as healthcare providers. If you don't mind, I'll dive into the questions.
Okay, no problem.
And yeah, is that okay?
Yes, that is fine. That is fine with me.
Okay. So Nabila is saying it's really relatable, just sharing your experiences. And I think that's so important, just so that people just know that they're not alone. And she's asking, what challenges have you experienced during the COVID lockdown, being immunocompromised and having a rare disease?
Okay, with me, since I started understanding sickle cell and understanding it in my way, I've decided to start taking risks. I'm not saying that I will literally go out there and decide to catch the COVID-19 virus. No, that's not what I'm saying. But like, instead of running away from the challenge that life throws at me, like certain um, diseases or illnesses, I'll rather go out there, face it, and let my body adapt to overcome it. I don't know if I'm making sense there.
Okay. So you're not, have you been during lockdown, you haven't been quarantined, you've just been, or you haven't been concerned about going out?
No, I am concerned. I'm still looking after my health because I know that if I maybe catch the COVID-19 and with my health condition, it's going to be bad. But at the same time, it's worth taking the risk and finding out what is going to happen, because I can't just, because the more I stay on lockdown, or the more okay, let me just say personally, like the more I stay on lockdown, the more I feel like I'm depressed. I don't know if that's a bit okay. Like I feel a bit depressed if I'm on lockdown. So I like to be outside. I prefer to do things, to exercise, to work out. So I would rather go outside, improve my body instead of sitting at home and not doing anything to improve my immune system.
I think taking responsibility for your health and taking a holistic approach. And there are other questions coming in asking to Prof as well, what precautions should we take in light of COVID? So maybe we can pass this over to Prof, who's back online, just to respond to that. And I'll also point out that there is on the Rare Diseases website, if you go to the COVID-19, click on COVID-19 on the menu on the homepage, that will take you through to various disease groupings, and sickle cell is listed there with some resources there for tackling, just in terms of how to approach this whole situation from a sickle cell perspective. But perhaps, Prof, you can give us some clinical insight here.
Yeah, so thanks for the question. I think COVID-19 in patient with sickle cell disease will not be different from the other population, but probably will be more damaging in the sense that any infection that affects the lung in sickle cell disease usually is associated with severity. There is one specific complication called acute chest syndrome, that is usually associated with infection in the lungs in sickle cell disease and associated with massive hemolysis. We know that, for example, some influenza infection in countries that can offer it are prevented, specifically in patients through vaccination. So I would suggest a double caution and you have sickle cell disease not to have a COVID-19.
Sorry, we're losing you, Prof. You said double caution.
Double caution because any respiratory infection will not be good for any patient with sickle cell disease. But of course, we don't have a precise idea at the moment because the virus is new. We would be studies between understand the effect of COVID-19 on a sickle cell disease patient. Maybe you information, but how that already no extra caution.
Okay, we're struggling to hear you there, but I think the gist of what you're saying is that we should essentially proceed with caution because there's so much unknown about COVID-19, and it would just be sensible just to be cautious.
Yeah, that's correct. But no, from other infection like influenza and lungs of sickle cell disease patient, it can be devastating. So I'll imagine that COVID may have the same effect.
Thank you. Thanks very much, Prof. There is another question saying children with sickle cell present with non-specific signs and pain can be a struggle to manage, especially in the very young child. With so few genetic counselors available in South Africa and dealing with families struggling with the diagnosis and their cultural beliefs, how do you suggest that we approach the families struggling with the diagnosis, especially when the children are admitted multiple times for crises and developing multiple drips? What can we do as doctors to help them through understanding the diagnosis? I think, well, we can open this to Prof and maybe to graduates. Maybe Prof first.
I think the first is the counseling that will involve a strong social and psychological component. The resilience of family.
Now we've lost you again, Prof.
Unfortunately, my internet connection is so unstable. I was saying that the psychosocial counseling is critical in those cases, particularly because the chronicity of complication in sickle cell and family to the children that are affected.
Okay, we lost you there at the end. Graduates, would you like to add something there from the patient perspective? What do you think would help? How do you see clinicians and genetic counselors, and especially where we've got such low capacity in South Africa, being able to assist? Graduates?
Yes. What I would suggest is, okay, we understand. Okay, I understand that there's few genetic counselors and doctors to assist, but sometimes parents who have kids with sickle cell, they would rather speak to another person who has sickle cell and who is going through the exact same pain and situation, because a doctor can explain to you this is what is going on with your child. Your child has this, and this is the life expectancy of your child, for instance. But then when you see another human being or an adult with sickle cell or another child living life like every other child, you will eventually be motivated to raise your child in a normal way.
Okay. And graduates, can you just confirm where you're from? You're getting some fan mail on the Q&A asking where you're from, and with all your healthy measures you have in place, do you still experience any pain crises? And if you do, how do you tackle it? And then we'll move on to our next speaker.
Okay, I am from Congo, DRC, Democratic Republic of Congo. When I experience my pains, normally, okay, so this is normally how it happens. I get like I can say a sense that I'm about to sickle. And it's normally with my lower back, even when I'm working out. So what I'll do is I'll just stop, whatever it is that I'm doing. I'll take some painkillers, even though the pain is not really severe. I will still take some painkillers, and I will allow myself to rest. That is what I normally do.
Okay. Okay, thanks, Graduates. We have got a few more questions, but I think we'll leave them until after Claire's talk. And so without further ado, I'm gonna pass on to our next speaker. Thanks very much for all those questions. Keep them coming. And thanks for a great talk, Graduates. So I'd like to introduce now Claire Engelbrecht. She's a genetic counselor at Tygerberg Hospital. She's a healthcare professional in medical genetics, obviously working as a genetic counselor. She's got a background of a BSc in genetics and human physiology with honors in human genetics and an MSc in genetic counseling. She's got a real passion for both science and patient care, which is how she arrived at her current profession. And her interests, specific interests in genetics, include cancer, hematology, and fetal medicine. And her connection with sickle cell really began when she was studying, and she became friends with a sickle cell warrior who really inspired her to do her research on the condition. And she was very much involved in forming South African Sickle Cell Support Group, along with Graduates. And she's going to continue working to do her part in creating awareness for this disease. And she's also got a very interesting hobby, which if you don't know, I'm going to let her tell you about that. But please go for it, Claire. Thank you. Claire, can you?
Oh, can you hear me?
Yes,
Helen?
we can hear you now.
Okay, it says my screen sharing is paused. Can you see my screen?
It's not coming through properly. Do you want to retry?
Okay, there we go now.
Yes, it's come through now. It's great.
Thanks, Helen, for sharing my secret, my sports. Well, not so much a secret, but we have to stay healthy, hey? So thanks for the introduction. You can hear me, hey?
Yep, we can hear you fine.
Thanks for the introduction, Helen. So I'm obviously Claire Engelbrecht, genetic counselor, as Helen told you about. And yes, I'm a healthcare professional, but I was also actively involved in starting the sickle cell support group called Sickle Cell South Africa. So I just want to take you on a whirlwind journey through how it all began, what we've done so far, and then just share one or two stories or feedback from two warriors as part of the support group. Okay, so a background to how this all began. So to become a genetic counselor, I had to study an MSc degree in genetic counseling, and this I did through the University of Cape Town. And as part of my studies, we had to do a research project. And I decided from a list of research options that I wanted to do my research focusing on sickle cell disease. And the reason being, and I think Helen already spoke about this in my introduction, was really inspired from a colleague and a friend that I met in my honors year studying human genetics. She's a sickle cell warrior herself, and she really inspired me and is just a stunning human being and showed me that life can be whatever you want it to be. So my research was a bit more of a qualitative research study whereby we looked at how patients perceive their health, so having sickle cell disease, to affect their quality of life. And I interviewed 18 adults living with sickle cell disease in Cape Town, all who attend Groote Schuur Hospital, to try and answer this question from their perspective. So what did we learn? Well, we learned that living with sickle cell disease is hard. Patients face often constant and unpredictable episodes of pain and illness. And as one can, I think, appreciate, this will have huge negative physical impacts on a patient, but it also has other far-reaching consequences, whereby it can really seep into all other aspects of life. And patients report their condition having an impact on their education, on their ability to get a job, to maintain a job. It has negative implications on their social, personal, and family relationships. Graduates alluded to this earlier. Patients face health-related stigma and discrimination because of the condition that they have. And all of these things, as one can imagine, has severe psychological, mental effects on a person's well-being. And because of these reasons, patients report a reduced quality of life when compared to somebody who doesn't have sickle cell disease or isn't living with a chronic condition. So we realized that, consistent with all the literature and all the research across the world, sickle cell has a significant psychosocial impact, and patients do report decreased health-related quality of life. And so this said to us, well, there's a role for a support group as part of the very complex care that patients with sickle cell disease need. So what is a support group? It's basically an organization of people who share a common disorder or an interest in a common disorder. And it is a place where they can communicate their experiences, share their ideas, and of course provide support for one another, largely on an emotional level. But it is also a platform for advocacy, whereby support groups really get involved in creating awareness around their condition, in educating patients, healthcare providers, and the public on their condition, and to be actively involved in research about their condition, all with the role of essentially improving patients' quality of life. So how it all started, so after my research project, we identified a need, largely myself and graduates, and luckily at the same time, we had a family from the States coming to visit us, a family where they had a sickle cell warrior, and it was a mom. So she herself runs the sickle cell support group in Illinois, and like she said, she's a mother to a warrior with a girl with sickle cell. And it was that warrior's wish to come to Cape Town, and we thought this was a great opportunity. We were going to meet with them. We were going to pick their brains. We were going to hear what it is they do for their support group back in Illinois, bounce some ideas off of them, and take it from there. And so we did. And then about a year later, 2 years ago, about a year later after that meeting, it was World Sickle Cell Day, and we had an official launch. So this was attended by healthcare professionals. You can see Prof. Wankum there giving a talk, patients themselves, and other people. We decided we were going to share what it is that we wanted to do in terms of a support group, and let patients voice their opinions about what it is they wanted and needed, and to put that all together to then take it forward. So we decided that the main goals, the three main goals for a support group for sickle cell patients in South Africa, was to create awareness and education, for personal support for patients within the group, and then obviously to support the research that is being implemented in South Africa and in Africa, all, like I said, with the aim of improving quality of life. So just to touch on what we've done in terms of awareness and education. So in collaboration with Sickle in Africa, which is a very large consortium governing the research of sickle cell disease in African countries, a very comprehensive information pamphlet or booklet was formed, and this was crucial in being able to distribute to clinics and to hospitals, to patients, to their caregivers, to be able to educate them on what sickle cell disease is, how it's caused, what are the complications that one can expect, what does one do if patients are faced with various symptoms. And once again, this pamphlet, which was about an 8-page pamphlet, was aimed to empower patients and their parents, and to be able to educate healthcare providers, because sickle cell disease is not a prevalent disease in this country. And you'll be surprised at how many healthcare workers out there actually have no idea what it is. Then we approached the Western Cape Blood Services. So given that patients with sickle cell disease often use blood products as part of management of their healthcare, and that the Western Cape Blood Services do drives to collect blood products for blood transfusions, we asked them if we were allowed to publish an article in their 3-monthly magazine, and they happily agreed to do this. So I wrote quite a simple introduction to what sickle cell disease is. They published it for us, and I hope that this got some awareness out to the general public out there. Then caregivers who spoke before me had his moment of fame on Carte Blanche. They ran an episode on genetics in medicine, and they interviewed him. So this was a really, really nice way for a sickle cell warrior to get the word out there about this condition, about what it means to live with this condition, and just to bring a face to how genetics and medicine is moving forward. So in terms of personal support, that aspect of our support group, there's a WhatsApp group for the patients to communicate in a safe space with one another, for support, for ideas, etc. We have a Facebook page whereby we publish all latest information, interesting news articles, any treatment that's are coming out. We allow, it's a platform for patients to engage publicly or privately if they want to message individually. And then I think the aims for the future, when life gets back to normal, would be to start a support group whereby we can actually meet face to face for a little bit more of a personal approach to the support group. And then how we've been involved in research. So once again, under the umbrella of Sickle in Africa, the patients are the voice of research and what needs to be done for research. And so one of the representatives from the support group took to the air. He went to Nigeria. He met with other representatives from other support groups all over Africa. And that's where they all shared a collective voice about how patients felt about research and what they essentially wanted to get from the research. So important to involve patients in this, because essentially at the end of the day, it's for them. So I just wanted to share some feedback from a young lady who herself is a sickle cell warrior, a young adult, and she couldn't stop singing praises about the support group. So I wanted to share how she felt about it and what she loves about the group. And she says that basically being able to connect with families, children, and young adults that are her age and that are going through the same thing is what she loves about this group. Before this group was started, she didn't know that anybody else had sickle cell disease. She was the only one in her family, and as much as they supported her, they would never truly understand the daily struggles that she faced as a woman with sickle cell. She says that this group has made it possible for her to have an identity outside of sickle cell, and that she's gone on to see that there are some individuals who have kids, they've graduated, they're working, they're getting married, they're living their lives. And this has really inspired her because she's a young woman at the beginning of this journey. And my favorite piece of her quote was, "Sickle cell is not something that should ever steal my joy and hinder me from loving life." And then this is just another sickle cell warrior that I've gotten to know, Esesa. So she wanted me to share these pictures with you. Maybe this isn't the not so pretty side of sickle cell disease, but the bottom line was, yes, the bad days happen and they're really, really hard. But at the end of it all, you need to achieve what it is you want to achieve, and life can happen the way you want it to happen. So these are some pictures of her in the hospital after having a hip replacement, just before having her twins, who are now 2 healthy, beautiful children. And there she's having a blood transfusion. And her message, and I think as part of the core group of the Sickle Cell South Africa, is to really inspire young women to know that they can have the futures they want, they can have babies, they can have their own children, and they can have the families that they want. And she sent me a short little video I'm going to play for you now. And I think this just really speaks to the support that everybody's giving each other within this group, and how valuable it was this group actually started. And starting a support group is not easy, I must tell people, and lots of sleepless nights, lots of gray hairs. But I think when you hear people's inspirational stories and how it's really helped them, it really just keeps you going through your busy schedule. So I'm going to share Cesar's video now. It's just a short one. And then I'm done, and I'll be happy to take any questions.
I am Cesar. I'm 31 years old and I live with sickle cell anemia as S. I have two beautiful children, twins, born in 2016. Just want to let all women know with sickle cell that we can have children. It is possible. It is such a beautiful journey. My pregnancy was quite simple in the beginning, but then towards the end, my hemoglobin levels started dropping a bit and I needed blood transfusions. But I was well taken care of by my doctor. It is important to pick the right doctor to cater to your needs. I was in hospital for a while and we had the children at 34 weeks. They were early, of course, but they came out healthy. They were well looked after and they were healthy, beautiful, and now they are meeting all their milestones. Motherhood has been the most incredible journey I've ever been on. Please, as women with sickle cell anemia, we can have children. Please don't ever listen to anyone who tells you you cannot. We can have children. I am Cesar.
Okay, great. Thank you, Claire.
Thank you.
That was a great presentation. There are a number of questions that have come through, and I think it's quite nice just having the three different perspectives that we've had and ending off with the support group perspective and the journey that you've been on. So a couple of questions that are directed that I'd like you to take, Claire. In terms of a lot of, and it seems to be a thing that's coming up both in the chat and the Q&A, is that a lot of patients are often too scared to go to hospital when they have a crisis because they're not taken seriously, and as you've reiterated, there's a lack of awareness, and so they get a doctor who doesn't know what it's about, and they don't know sickle cell, and they're not taken seriously. What are your thoughts on combating this? I mean, other than obviously getting the awareness out, the brochure out there, what else do you think that can be done? Because we know that we've got a lower prevalence of sickle cell in South Africa. And so that is part of the problem, but how do you think we can combat this?
So that's a good question, Helen, and maybe I actually should have mentioned it in my talk. Was initially when starting the support group, we were obviously asking all the questions about what are the hurdles that patients face and how as a support group can we overcome them, and that was one of the key questions. And what was actually implemented at Groote Schuur Hospital, which is not universal to all the hospitals across the country, but maybe needs to be given a bit more thought, was an emergency card. So just like a patient with hemophilia would have a bracelet to say, this is my condition, and then the healthcare professionals would be alerted to it, would know how to treat them. An emergency card was created whereby it had the patient's diagnosis and relevant emergency treatments that needed to be put into place, along with obviously the contact number of the treating physician. And so it was kind of like a summary about how to manage a patient appropriately and to be able to explain the condition to a patient without to a healthcare professional without the patient having to do that themselves, which is sometimes hard. So I think that is definitely something that we need to take a relook at. It was distributed to, like I said, to adults at Groote Schuur Hospital with the condition, but it hasn't been implemented anywhere else. Not at Tygerberg. I'm not sure about Red Cross. I've obviously moved across to Tygerberg, so I'm a bit disconnected from those two hospitals. But those are the two main treating centers. So I think that is one way to combat it. But yeah, I mean, I think as much as we are saying this till we're blue in the face, it really is just about educating patients, healthcare professionals. And I think to make this condition or teaching about this condition part of the curriculum as well, for medical students, because the numbers of patients that have increased in South Africa because of immigration, socioeconomic circumstances in different African countries is significant. The last time we looked, there was a 400% increase in patient numbers. And that's something that can't be ignored, and that's something that now doctors also need to face in their training, because it is something that they're going to come across a lot more frequently, and they do need to know how to manage it properly. So I think those would be my two main suggestions from that aspect.
Okay, thanks, Claire. Another question that's come up is around genetic counselling, and the question's asking, do genetic counsellors play any role in a patient's mental health, or do you advise patients and parents, caregivers, to see a counsellor, a different counsellor, as they go through life and face the challenges such as pain and the quality of life and isolation and so on? I think that's just a good opportunity just to clarify the role there of a genetic counsellor.
Yeah, so for those of you who don't know what a genetic counsellor is, and I don't blame you because many people don't, our role is within the field of medical genetics to educate patients about the medical implications of a disease, so what you can expect, to educate patients about the cause, so what are the underlying genetics, how is it passed on in a family, what are the risks to other family members. But our role is also to support, to provide psychosocial support, because we know that living with these chronic conditions has far-reaching implications beyond just the physical, and we are there, you know, to explore how it's been, how are you coping. And I think it's our role. We are not psychologists, we are not long-term therapists, so no, we are not the right people to follow up long-term, but I think it's our role. We've got some psychosocial training to assess those patients that are in need of more long-term care, and then to make appropriate referrals. So that's where we kind of fill the gap. You know, if you feel like a patient's coping well enough and all they need is connection to another patient so that they can share their stories, or they just need to join a support group so they can WhatsApp each other, or if you feel, look, this person's really not coping with this condition for whatever reason, I don't feel it's safe to just let them go, then you would definitely make that referral. But short answer, we do not do the long-term counseling, but we do the short-term psychosocial addressing and assessment.
Thanks, Claire. We've received apologies now from Prof, who's had to drop off the call, and I see we are just over our time limit. We have had a few technical issues in terms of poor internet connections, which have just slowed things down a little bit. There are two other questions. I'm not sure if you're going to be able to answer them, Claire, or not. We can always forward them to Prof via email. But the one that we can direct to you from Merlin is she's not aware of a support group for sickle in Johannesburg, and there's a number of patients in Johannesburg, and most of them, or a lot of them, don't get referred unless they're pregnant, and they're available. We are available. Okay, so the services are available in hospitals and telephonically and on Zoom and WhatsApp, which is great to know, to have that resource there. Claire, in terms of the network, and Graduates maybe, in terms of the network that's existing through Sickle Cell South Africa, are most of your members down in Cape Town? Are you planning to do a drive up in Joburg to extend the membership, or what's the situation?
Helen, so Cesar, the lady whose video I shared, so she's from the Gauteng region. She's from Johannesburg, and she actually, she contacted me, and she said that she was very keen to help in whichever way, to support the support group, to grow the support group. So she's definitely a key person I think we could get involved in extending the support group over to the Johannesburg side, because yes, it is largely Cape Town based. Our events happen here. It started here. And if we do speak about face-to-face groups, they will be implemented first in Cape Town. But yes, there's varying support group members that are from different areas that I think would be more happy to branch it out to those different areas. So with permission, we can share information, we can share details with the genetics community in Joburg and see how that could work there.
Great. And I see Nabila's got her hand raised. I know Nabila's also been asking similar questions in other forums, so I'll just unmute her so she can also join the conversation. Okay, go ahead, Nabila. Oh.
I'm from Johannesburg as well. Rare Diseases had a webinar yesterday, and I actually brought this up. What we've also decided to do is to make little cards or pamphlets just with rare diseases and alerting the hematologists, pediatricians, just that there is a support group, not just for sickle cell, but other diseases as well, where they can advise patients to join. So this, Kelly and myself will just play on what's on that pamphlet. And I'm a pharmaceutical rep, so I'm always in and out of hospitals, so I can leave it with the healthcare professionals as well. If each time they get a new sickle cell patient, they can refer to the group.
Thank you, Bila.
Yeah, I think that's a great way of just getting the word out there.
Yeah.
So I'm just double checking, and I think we're going to close off now as we've gone over time, but we've had a lot of comments and questions coming through. Those other ones for Prof. Wonkum we'll actually forward through on email. And if you drop us a line, those of you that have asked those questions about treatment and gene therapy, we can actually respond to you directly if you email us at admin@rarediseases.co.za. But without much further ado, I'd like to say a huge thank you to all of our speakers. Thank you for making the time this evening to share with us. And we've had such amazing support online with so many participants joining us from all over. Thanks again to Novartis for funding and supporting this webinar and enabling it to happen. And I do apologize for the slight technical hitches we've had with the rather poor Wi-Fi quality tonight. It was a bit unfortunate that we couldn't hear everything so clearly, but I think what this has really served to do, sorry, the email that you should send it to is support@rarediseases.co.za, not admin, just send it to support. But thank you so much, everybody. And yeah, it's just been a real inspiration having all three perspectives. And if you've got any other feedback or questions that you'd like to send to the panelists, please email them to support@rarediseases.co.za and we will forward them on. Thank you for putting up with my chairing abilities this evening in lieu of Kelly, who again sends her apologies. And thank you very much, everybody. And this has been recorded, so it will be available for download. So thank you very much, all our panelists.
Thanks so much, Helen, for always being part of organizing these events. Without you guys, I don't think we'd do them as well as we do.
Thank you, Claire. Thanks, Graduavis. Thanks, all our participants, and thanks, Prof, who I know has already left us. So stay safe out there and drop us a line. Okay, thank you.